Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today, we have a renowned gynecologist and obstetrician who has set a world record and a Guinness World Record in screening the cervix cancer patients. And apart from that, she is an expert in colposcopy as well as a robotic surgery. And that is none other than Dr. Parimala Devi. Welcome, Parimala Devi.
Namaste,
We
madam.
have heard about scopy.
Good morning. Good morning.
Okay. We have heard about lots of scopies, endoscopy, colonoscopy,
Yes.
sigmoidoscopy, and then capsule endoscopy, enteroscopy, cystoscopy, bronchoscopy, where the lung bronchus are seen. Everything is there. But what is this colposcopy? Please explain to our viewers.
Thank you very much, madam. Tasme Guruve Namaha. You are my great teacher and always a teacher and a mentor. Thanks for this immense opportunity because this talk goes with the lot of women for prevention of cervical cancer. So I think it's a great justice for the womankind if we speak about these topics. There is scope. You are giving me the scope to speak about this topic. Like that, there are many scopes. Many
Okay.
scope, as you said now very rightly, for every organ of the body, there is a scope. But
Yes.
when it comes to all other organs, things are okay. But there should be one thought. What about the cervical cancer when the incidence is so high, like 75,000 women die every year in our country? One third of the global incidence of cervical cancer is in India.
In India.
Breast cancer is first and second is cervical cancer. How do we eliminate this? WHO is working, actually, it has come with a war foot to see that by 2030 cervical cancer should be eliminated. How do we do this elimination? It may be by just examination, awareness, pap smear, and another special instrument which is used and treated is colposcopy. So what is this cervical cancer? It is nothing but the uterus has got many appendages. We all know that uterus, ovary, part of the cervix and all. The cervix is the neck of the uterus, we can say. If we just take out this part, this 3 centimeter is cervix actually, which is attached to the jananendriya in Kannada or vaginal wall. So this is very important in the sexual act also, and also for delivering the newborn by dilating itself many a times. And also it is the main thing in our regular menstruation every month to put all our toxins from the uterus out of our body. So cervix actually plays a very important role. To see this cervix, the instrument, through this vaginal fold, we just focus on magnified stereoscopic light that goes and magnifies this cervix into many a times on the screen. And we can see it and we can understand what is the health of this cervix. Actually, for that, from ages we are doing pap smear. Pap smear is one where we just take the discharge from a swab and put it on slide and send to the cytologist. So they will opine whether this pap smear is normal, abnormal, or it has got some abnormal cells there. But treatment doesn't stop there. We have to confirm it. Just because pap smear has some abnormal cells, we cannot treat that woman. These days we are practicing the evidence-based medicine, that too because of our Google University behind. People are
you have to have a proof. You have to have
aware
a proof
of many
that
things.
there is a
So
cancer.
yes, true. Evidence-based medicine. So to see this pap smear report, that's a theory. To put it into the practicality, we use this instrument called colposcopy. Colposcopy is an instrument where there is a magnified lenses are there. When we see through our eyes through those lenses, the cervix we can make out, is there any erosion, is there any polyp, or is there any suspicion? Is it looking normal or is it looking something abnormal? Something abnormal, if it looks also, it is something like we have to be cautious. It is, then we show to the woman because it is coming on the monitor when we are seeing, see, this is cervix. Through this, we make them relax by telling, see, your baby, your girl, whole actually once upon a time, see, it's so amazing. Then they will understand, oh, this is cervix. Otherwise, they will think cervix means the cervical spines, many people. So, along with them, because of the privacy of the room, we call the husband who has come with her many a times, or the mother, well-wisher, whoever has come, to come to that room and to watch that monitor. Like how, madam, in your cath lab, the outside attenders will be standing
Correct.
your this one stent and all. They will come and see, and we explain them. See, this is the cervix. She has some problem. You should bring her for the follow-up and treatment. Otherwise, coming for the follow-up for these things is very difficult, madam, because it's a modest
Okay.
area. Women also will not be
Okay.
very happy to come again and again, and
Okay.
they will not understand. Even though they love her, they don't understand what is going on with her. They will think,
The
"Arey, so much
importance.
treatment we
Yeah.
are getting her, not getting all right." So then we show them this requires definitely some treatment after a biopsy or whatever it is.
Dr. Parimala, my question to you is, are you just seeing if there is a cancer or a tumor or a ulcer or any inflammation, or you take the biopsy also? Because you have to have the proof, no?
Yes, biopsy whenever necessary. Yes, proof, evidence-based medicine practice. So, because we use some lotions and some steps are there, about 7 steps of colposcopy, then through that we will understand there is any suspicion or it is okay, normal service, we can give some medicine. If there is any suspicion of some ulcer or anything in this area, most of the time you take a small pinch of like one tur dal, whatever we say, like this togri bele, like that small biopsy and send. But if at all, if there is a bigger lesion, like quite painful or
Big
anything, and
tumor,
sometimes
yeah.
they bleed. Sometimes
Yeah.
when we are doing the colposcopy, they suddenly bleed. That time we don't go for biopsy because if it is a
Okay.
soft ulcer or anything,
Yeah.
that bleeding may be normally she may be bleeding because she may be nearing to her menses, or it may be
Okay.
because of some abnormality which is going on in her cervix. Because some
Okay.
women will come with postcoital bleeding only after the
Okay.
coital act. Postcoital bleeding is pathognomonic that we have to use this instrument colposcopy and take a biopsy. But sometimes at that spot only you may not be able to take biopsy. We place them under little anesthesia, make them comfortable and take a biopsy. So like this, we can treat the cervix and prevent the hysterectomy. There is another point I want to insist here.
Okay.
Because if a woman has come at 45, 50, for this ulcer, there are n number of hysterectomies done all over our India, we can say, some
Yes,
part of
yes, yes,
states. Yeah,
yes.
they don't even see the age, anything.
Any bleeding, remove the uterus. That
Yes,
was
remove the
once
uterus.
upon a time. But
They
now,
instill that fear. Oh, you are
yeah.
having bleeding. Why you want now? You have 2 children. Come on, take out the uterus. But I believe, I think with your guidance, as we have been taught, preserve any organ as much as
Correct.
possible,
Yes.
unless it
Yes.
is so much abnormal and troubling you. So this is our concept, saving the uterus, treating the pre-invasive before it becomes a cancer, treating it in pre-invasive lesion only, and make her very healthy to her age,
Okay. One more
the
question,
lifespan
Parimala
what
Devi.
God has granted her.
Yeah, one more question I have is, most of the women, they go for the ultrasound and they get all the reports and all that. Why I have to go from below and look
Yes,
at the cervix?
yes. Yeah. Usually in the ultrasound, we cannot see the cervix so much. If you see
Okay.
also, we have to make her bladder very full and then only we can see just the length of the cervix we can see. But the surface of the cervix, the ulcers, we have to see from the down in the direct
Below.
vision only. Because that part is not seen in the ultrasonic images. Because it is in
Okay.
between the thighs. It's a small,
Okay.
this one, the thigh shadows will not make it evident on the ultrasonology. And the pathological pictures we cannot see at all in the ultrasonology. We can see the length of the cervix, especially pregnant women, we can assess it.
Yeah.
So, like this, colposcopy has been a boon to the women, and it has been very instrumental in preventing cervical cancer. For the WHO to make cervical Mukt Bharat, colposcopy has stood as a strong rock or pillar in diagnosing and treating these women, madam.
Okay. So you are not only diagnosing and treating in time, you
Treating.
are giving so many years of life to the woman. See,
Yes.
many youngsters, at a young age, 30, 40, they were dying with the cervical cancer. But now by preventing it or treating it in time, your stitch in time saves 9 or saves life, you can say. So
And we
I think
usually say kill it before it kills our woman. Kill that lesion
that's a
before
wonderful
it kills our
one.
woman. That is for
Yeah.
this also and for HPV vaccination also. Usually we have to say
Okay.
that.
Vaccination is for prevention, and this colposcopy is for the treatment.
Colposcopy
So,
treatment,
precise
yes.
diagnosis and accurate treatment in time. So, the timely
Yes,
treatment
yes.
matters a lot for a woman. So thank you very much, Dr. Parimala Devi. So beautifully you have explained what is colposcopy and what is the importance. I hope
Thank you,
all our
madam.
viewers,
Hope-
they have realized the importance of this and preventing the cancer of the cervix or treating it in time in the stage 1 itself before it becomes very advanced. So thank you very much.
Thank you, madam. Thank you very much for giving the opportunity.